put me online now. I need education, I need information and news. TDA will let you know. We bring you entertainment, we bring you the people's view. We don't just do the talk, we verifying before reporting. We don't just do the talking, we verifying before reporting. In independence and credibility, that's why we are here to bring you unbiased news. We believe in independence and credibility, because we are here to bring you unbiased news. TDN Africa Media. TDN Africa.
Welcome to TDN Africa Media. This now a program Well Body, where they come to you by TDN Africa Media. My name is Sylvia John. Today we there so with one Master Sabi doctor, and we they talk about hepatitis B. Doctor, you can introduce yourself, ma.
Okay. My name is Dr. Sharon Abokie. I'm a medical officer currently stationed with Bo Government Hospital, and they are today with TDN for try for pass some medical information to we all.
Okay, doctor. So I don't introduce the topic when hepatitis B. And for family where they watch this don't be a concerning or let's say outrageous disease in the country. Everybody they like this person gets some or the rates don't high. What do you want to say about that, doctor? Explain you will we understand.
Okay, well, Nadande we there for today. Like you don't say, you don't need to be a medical person for no say hepatitis B, especially now a sick way they on the rise, and then the best we can do now for educate ourselves, educate people there around we, so that we go able to know about this, because like you say, knowledge now power. Where you know about something, you get the knowledge for able to address them appropriately. And specifically, apart from the fact, say, yes, now something we don't begin go on, as much as na sick way they among we, not to just ordinary sick, na sick way in complications can be very severe, not so like malaria where you go now pharmacy, you go take malaria medicine and it don't done. So it means say people they really get for know, and not just for know, but for be aware. Say this na sick way, if you understand what I'm early, it will save you from a lot of complications there. So one begin for no waiting at this hepatitis here. When I don't say medical term, what we get big words there, but simply not just a sick way they affect the liver now we body. It cause the liver for inflame, it cause the liver for swell, and they unblock the liver in normal function. So what we say hepatitis now a sick way. Now if you like, I feel like the most common viral infection we all man know na corona. So not to the same sick, but like na the same kind of tumor they cause the sick. In back na virus they cause them. But when we say hepatitis, we can be very specific hepatitis B, because other kind and they. We get hepatitis A, we get hepatitis B, we get hepatitis C, we get hepatitis D, and we get hepatitis E. And we get other viruses as well. We're not there among these viruses that what I don't call, we can also cause hepatitis. But today in particular, we want to talk about hepatitis B, because as for now, Nadande we see say they really not amongst we, and then they really affect we as well. So with we small time now the hospital facilities there, we they see more and more patients there. They come up positive for this sick year. And in fact, now we don't even begin to have like a routine. Like how they go now hospital and go test you for malaria and typhoid. Now so we they do a routine check now for hepatitis B, because it's also very, very common. So we want to take this time here for know more about this sick year, because it's very important. So usually we can get statistics there where the big organization they can do, WHO, CDC, but this time around we're very, very fortunate. Forget we own statistics in our salon, where we own infectious disease specialist Dr. Lako. We don't do a research, I think in 2021, and for check the prevalence, that's to say how much of we people them actually they walk around with this sick care where we actually not know about. So it do a prevalence study in 2021 for hepatitis B and hepatitis C for see how much of this sick care we get. And the results of the research been so interesting that a lot of people them actually get this sick care among we. And not so also that this research also go ahead for pick up some groups them of people that were much more susceptible to this sick care. And it was surprising for no say among the highest number there, the groups there, now we the healthcare workers them, because every day you they exposed to patients them, we will know they check, you need to know the hepatitis status them, we they deal with bodily fluids them, urine, blood, and all what's not. So we they become more and more exposed to these diseases that we will not even know about. So now that make we more and more they can't do with them. Apart from the healthcare workers, we see say even belle woman they can't do with hepatitis B and C. Obviously, hepatitis B much more prevalent compared to hepatitis C, and it also much more damaging compared to hepatitis C. But if I say we get statistics for both of these viruses, them. Other groups of people now the blood donors them. So when you go now hospital, you fumble them, you person they need blood, you go now blood bank for let them go for you go donate blood for your person, and then screen your blood, because then they screen for all them sick them, because you don't want to take bad blood and then you give person. So during the process where then they screen these bloods them as well, then they realize say a lot of the blood donors them they also come up with a positive hepatitis B positive serotype now them blood them. Then also school going children. Imagine at that young age children they're more likely for sweat, touch themselves and all what's not. So them also now a group of people that we don't see say they then get a lot of this infection. So what do we go do? According to that to that research, interesting enough, the prevalence of hepatitis B is very, very close to the prevalence of HIV and SALON. And that is how very, very important it is for making me and you be very aware of hepatitis B infection. Hepatitis C also, like I say, is prevalent, but it's not as much as hepatitis B, according to this study. So the next thing we want to talk about now the transmission. How are they get them? How are going to say I don't get this sick here? Waiting at the ways that we are able for prevent for land not get this sick here. All land they can answer. But before we know, we get different kind of classifications of this sick here. For lay easy for lay we self understand. You don't need for be medical person for understand. We get a phase of the sick when at the acute phase, that's to say you don't get this sick in your body in not past 6 months yet. Then we get another phase when at the chronic phase where you don't get this sick in your body, it don't pass 6 months. Then we get another phase what they call acute on chronic, where you actually don't get this sick here past 6 months, but you be okay. You don't get no symptoms, you just they go about your business, but then you get a sudden attack. So even if they do all your tests and then say, okay, this person likely don't get this sick here for more than 6 months, but you go to hospital and you feel some signs and symptoms them where you feel like saying just know you get that sick in your body. Then we get the last classification what we call the fulminant hepatitis. Then they now the most severe form of hepatitis, and then it presents with acute illness and it be very, very severe. So now we don't get this understanding about the different classifications, we want to know how person they able to get this hepatitis B sick. Any contact where they get with a bodily fluid, especially the one where blood exposed to, you likely forget contact. You likely forget this hepatitis B sick here. So the first one we will all know now during mommy and daddy business, because obviously we they exchange some different type of fluids them, so possibly not get them able for contract them during sexual contact. The second way where we able for get them now where they share any sharp or any item or any equipment we're able for prick you and for cause blood for be exposed. So the first people, like remember with statistics and with research where we be member about say healthcare workers, and are one of the people them where we they see say get more of this sick here. And now this make the cause them, because obviously day in, day out, then they in contact with body fluids, needles, syringe, they take sample, they try for give medication and all this. So, and many of them can get pinprick injuries them where they expose them to all of them diseases here. Then also, people with the way they work in a saloon, for barb, the clippers, the nail cutter, all them things, then they expose people then. Once you're able for mistake and come in contact with person in blood, you're likely for be able for transmit diseases if that material they infected. Also, another group, a precious group of people they win at the belly woman. You as belly woman, if you don't know your status, you go get belly, it likely for make you transmit this sickness to your pikin. Because obviously we know say through the placenta, the mama and the pikin, they share blood. So also we get we brothers them way they into the bad habits them of using drugs them. Majority of them can inject blood then drugs them into their veins them using syringes, and because they not get access for able for renewal, you will see 3 or more young boys then sit down, they share the same needle. And then we also young boy and young girls there we they into tattoo, then they where they drop at this person the same machine and then go use for drop for the next person. So obviously blood they in contact with their equipment them, and if they don't use them per person we get the infection and they can't use them per yourself, you get the likelihood for able for present with this sickness. So we also mentioned body blood donation. So where you as person you don't know your status and you go donate blood to other person and they not properly screen them blood, then it's possible for let them go transfuse person and get this hepatitis B. Now that make we know say with blood banks and they put all the importance and strict measures them on evaluating all the blood they donate before then they get them up for transfusion. So how me one know say I get this hepatitis B? Because sometimes I okay, I they feel fine, I don't get any symptom. How me one know? The first thing we for know is that majority of people they not get no signs, they not get no symptom. So you go they walk up and down, you they feel okay, but you they feel like, but you don't know say you actually get this infection. So apart from the fact that you know they feel anything, even when you begin to get symptoms, it can take a very long time for make people then go to hospital and know say actually na hepatitis B, because the mild stages of the symptoms then it can feel by any other malaria sick way we can get. You ate the turn, your body they warm, you they feel for vomit, or you actually they vomit, sometimes your belly go dry, and we all don't sabi most of them symptoms they like malaria symptoms. So when people then begin feel that they then first thing that they can do now for go na pharmacy, take 2-3 or spend some days, then they take over-the-counter medication. Maybe the way they don't repeat them like 2 or 3 times, then take malaria, then take typhoid, then see say it still persists before they go decide for say not go to hospital, but I go see do test and see actually what they do me. And definitely from the time where you don't begin feel symptoms to the time where you actually they go to hospital for seek medical attention, some amount of times they don't elapse already. So, but some specific symptoms then you see some discoloration in your urine, and then you also see some discoloration. Obviously, urine will become darker or more yellow, of which people can also misinterpret them for malaria. Then also yaiba can yala. Some people then go say when they yala, either na belly they don't get, or now they get other way then they attribute them to other diseases as well. And then more significantly, we get a belly heart. The belly heart specifically will be on your right upper side. Now they more the belly heart can start, or sometimes you can begin to say where the complications that they set in more and more parts of your bodies than they amble, and we could go down to that side there. But we can see that from the signs and symptoms, you're not able to pick this one particular symptom where you feel and say this now hepatitis I don't get. So you're not able to rely on your signs and symptoms or wait for that begin feel this symptom here before I go to hospital. So now that make we go to the fact say majority of people then will get hepatitis B then get for recover. Yes. Now that make we begin by classifying the different ways the way hepatitis B they present. We say the first one are the acute phase. So this acute phase, most people then it can happen during adulthood where you don't turn big man. you don't turn big woman, you get this infection here, and you healthy, your immune system very strong, you not get any other co-infection, then you not get any other sick then way your body they fight with. If not the hepatitis B no more you get, most likely majority of adults them then go able for fight this sick here, and even when you test them after 6 months completely, you not go able for find this virus now then system. So the second stage now the chronic stage, where even after 6 months you still not able for your body still not able for fight this sick here. Now that makes sometimes even if you go to hospital, then go test you, then say it's positive, they refer you to a doctor. The doctor will say, okay, once you not get no symptom, the doctor will say, okay, go and come back maybe after 6 to 8 weeks, but let them repeat the test, because your body they take some time. They try for give your body some time for see if your body able for fight them, then fine, you don't need for go further for any medication. Then we just advise you for go take the vaccine. But if you come back after that period of time and they test you and they say this virus still in your system, it means that you now are a chronic carrier. And also another factor for know, as a chronic carrier, many times you not go even know say you get the sick, but you they carry the sick and you able for transmit them at one or more points in time during that period day. So the best thing we for do now for test ourselves. I know say it can be very strange for me young person just grab and say I want to go test myself for this and test myself for that day. But now part of the knowledge and part of the education. So we're not for the wait first, say sick they come, especially then sick then way not very specific. You know be able to pick up this symptom and say now this sick again. If I follow you catch them early, because as we they go down with the say the virus is not just a tap with that inflammation or not today it tap, it gets some complications then. And then the more we they see as healthcare workers now the hospital, we had one except we they do like a routine checkup, which now then we don't begin for do now the hospital where they go for your routine labs. We had hepatitis B day. But apart from that, people majority of we patients they come in with 1 or 2 complications of these diseases that are already setting. So why you go wait for make that complication they happen? If by now you able for just it will just take you for go to hospital, for go do on a for go to lab and go check your hepatitis status, for be able for counter this sick here as early as possible. So when you go to hospital, definitely, if you want to go check your hepatitis status, you go check your hepatitis status. Either you come positive or it can negative. If your hepatitis come positive, like I say, we will want to know if you're not an active carrier or you're not a chronic carrier. So then you doctor go able for help you more with that and for know if time don't reach for let you go on your treatment or not. And then if your result come in negative, fine. But then they enough for stop day. You for go ahead for become vaccinated for this sick here. So obviously we don't begin to talk for ways then for prevent. So we don't actually see all the ways the way we actually they get them. So if you want to prevent them, you need for avoid them. So number 1, we begin with sexual contact. Obviously we always they preach for protective sex, especially if you're not married yet and if you're not sure whether your partner get multiple partners or not. It's much more advisable for get protected sex. So not to just HIV, they protect yourself from, or STIs, hepatitis B as well. You're able to contract them with unprotected sex. Secondly, for contact of body fluid, if you're not a healthcare worker, you don't need to wait for the government for do that, even though by rights, protection of the healthcare workers now, some of the issues that way the government for address, but still you can take the power in your own hand and make sure, say, as a healthcare worker, you make sure, say, you are vaccinated and you are protected, because you're not able to reduce your risks, because they come in contact with all them patients them every day, and you're not able to tell who's one gets them and who's one not get them. So the best bet now for you protect yourself. If you're not belly woman, get the test. If you get the test, if you see say you positive, then go either give you vaccine. If you see say you negative, then go give you vaccine. If you positive, your physician will tell you either for begin your treatment or for wait after you born. And immediately you born you begin, then go also vaccinate you begin. As long as I know now, we get a pentavalent vaccine where every begin they get as soon as possible. So then get the immunization schedule and the time where the picking forget them. And hepatitis B vaccine, they part of the pentavalent vaccine. So Kumbwa, when they decide for maculate you picking, this is now an advice to all of you, because all that vaccination at that young age, they go able to help the pikin for prevent complications them later. If we were they work in a saloon, we always, from when we small, they teach we say some items then are personal items that you know for share, like nail cutters them and all them sharps then some items then they back like file and other things that we able for injure person way sharp, where you know say every customer forgets in you as well. If you're not a man, you the bag with clipper, if I forget your own personal clipper, or if na blade, where one person, where they use blade for one person, no use them for yourself, you buy new one. For we brothers, the way they for illicit drug use, una can learn say, not for do am. So back to that day, we don't already know some of the ways that we would contract them and how to avoid them. But the mainstay of prevention na vaccination. So currently with vaccination schedule na Sierra Leone, we get 3 doses of the hepatitis B vaccine. We take it today, after 1 month from the day where you take your first dose, you take the second dose, and then after 6 months from where you take the first dose, you take the last one. So, and according to statistics, if you complete them 3 doses at adulthood, at least for the next 30 years, you will be able to get immunological protection from hepatitis B. So just 3 doses of vaccines then go able to protect you from a lot of issues then. Then, when you go to hospital, you get for ready, because hepatitis is a sick way, as much as it affects you, it is also able to affect the next person. So if you come and they ask you, begin ask you some personal questions like you and Uda Dena host, Uda na you partners them, especially for patients who don't test positive. Not so because then they try to make you uncomfortable, because of we know how easily communicable this sick be. We want to know Uda and Uda likely don't come in contact with you, and how you for advise them for able for go for this test. Let themselves back go test themselves. If now you well, if now you picking them, or any of you caretaker, anybody where they near you, or anybody where you feel like recently you don't engage in sexual intercourse, you can advise them for go check themselves, let them know their status, and then if they come negative, let them encourage them for us to take the vaccine as well. So when you reach the hospital, we get some basic tests that we'll go do. We'll go ask for your full blood test, we'll ask for the liver test, and sometimes then we can go further for ask for the wet test. We can ask you for do scan for the belly, for let we see, because we can begin to talk about some few complications them of this hepatitis B. Because sometimes when people then go say, hey, na hepatitis no more I get. They don't ask me for go do this scan, they don't ask me for go do this test, they don't ask me for yes, because now that way they will go able for know exactly the stage at which this infection day and how we go able for combat them as healthcare workers then. So some of the complications then. The first complication of hepatitis B, where I want to talk about now the reactivation complication. So we don't talk about the chronic carriers them, right? Where the sick care don't persist by them for more than 6 months. But some of them chronic carriers and they not get no symptom. Then they go with this sick care, then they work on a street with them, then they go about their daily lives then with them, they need to know. But certain things that can happen where go make the sick come back again, even though your body be not able to suppress them. And some of them things then are anything we're able for press down your immune system. That's to say you soldier man the way it can fit sick for you. If something do way and bug them, like you don't get all that sick, specifically HIV, because you know say HIV now then soldier man then now your body it affect. So any sick way they by you, or any sick step where you not be easy for contract before because you soldier man be effects for you. But when them self don't sick, they're not go able for effects for you. So you go see say the hepatitis B virus they be reactivated now the body, and then go present with your signs and your symptoms then. Second thing that complications that we want to talk about now, this big one where they call cirrhosis. Cirrhosis just simply means say your liver don't begin, the structure of your liver don't begin for change. So not to the function now of the liver they become affected only, even the shape of the liver. We know say we liver fiber triangle normally, like an oblique triangle. But where this cirrhosis don't begin, your liver they shrink and they cause some kind of changes that were very difficult for come back to normal. So therefore now one of the complications then of hepatitis B virus. And when you know which na this cirrhotic level, your symptoms then definitely get for be severe. You go begin to say your body not able, the work where the liver been they do before, you not go able for do am. At that stage, they present patient that they present with very clear and typical jaundice. They see the eye very yellow, and if you see black man with maybe yellow or possibly light skin or even white man, you go able for even pick the jaundice from their skin and then the urine as well. And then it can lead to the belly they swell, the foot and begin swell, and then even up to a lot of complications where they affect the brain and every other system in the body. So we don't see how from simple hepatitis now we don't begin get a lot of complications. We know they look well. And then when the structural changes then don't begin happen, two things able for happen. Either your liver fail completely, that's to say the work where the liver plans do in the body, you're not able to keep up with them at all. So your liver they fail. Any drugs, any food that we usually in the liver they metabolize them. You go see say the liver not able to do that work day again. So every part of your body get fulfill this condition here, this complication. Also, your liver able to become cancerous because when anything begin change shape and form, it likely for always develop into cancer. And at this place, part of the world where we find ourselves, cancer is almost a death sentence. So why not go now, check your status. If you need for begin your medication, you begin appropriately. If you not get the hepatitis, if you need for begin your vaccination, you vaccinate appropriately as well, so that we go reduce all these risks here and the complications. So we don't talk about the complications, we don't talk about waiting hepatitis, we don't talk about the groups of people that are more susceptible, we don't talk about how to prevent them. So now this I get for tell we today about hepatitis B. Now thank you.
Well, family, we don't see waiting, we don't see udoyeri, and we don't learn a lot about hepatitis B because of Dr. Sharon. But doctor, I get one thing I want to ask you because this is not something we're very popular among the people them. The first day my question was, how we go do now because since people in the sweat. So now to say hepatitis they transfer through sweat.
Yes, like I say, bodily fluids. Anything where your body they secret, it likely for transmit through them. But usually, you where they transmit them and the person where they receive them. The person where they receive them, likely even if it gets into your sweat, that virus still need for anyway for go into in blood system. So it means that you need for get an exposed area in your body where go give access of that virus into in blood system. Because if you left now in skin, you're not going to do anything to them. You understand?
Yes.
So you, not to you, the person will get the virus able for produce them from any of your body fluids. But you where they contact them, that virus need for get into your blood system for they infect you. And where they go up and down, sometimes you go they watch your skin, you go feel say cuts not there because you feel pain. But when you watch now the skin closely, you can see some half cuts where you're not aware of. So now that make you more susceptible for get the disease.
Well, family them, we also hear where Dr. Sharon be they give you some information. Usa say, you know, for do certain things them for avoid forget this disease. On allow we listen to the master sabi people them because now then they also forgive the well body and the wellness who they look for. We don't come to the end of today's program. I hope you enjoy them and I hope you learn boku. Because this is not something where you for play with. This is not something where like na life issue. You for take them very seriously. Una not forget say this program they come to una every Monday, 3 p.m. and na TDN Africa Media, they count to you. We get different sickness them we get doctors that we go can talk about. We wanna go learn about, then causes, what you go do for let it not happen, and so on and so forth. Doctor, I'll let you introduce yourself one more, tell us wrap this up.
My name is Dr. Sharon Abokie, medical officer with Bow Government Hospital. Una thank you for listening.
And my name is Sylvia John. Una continue for watch TDN Africa Media. Bye.
TDN Africa. TDN Africa Media. TDN Africa Media.
Mommy say put me online now. I I need education, I need information and news. TDN will let you know. We bring you entertainment, we bring you the people's view. We don't just do the talk, we verifying before reporting. We don't just do the talking, we verifying before reporting. In independence and credibility, that's why we are here to bring you unbiased news. We believe in independence and credibility, because we are here to bring you unbiased news. TDN Africa Media. TDN Africa.